One project deals with the evaluation of indoor air quality at schools in 3 different countries, in Denmark, Belgium and Greece, in order to understand what are the levels of different kind of pollutants, specifically some chemicals, but also the presence of ultrafine particulates in the air. And we aim to evaluate what is the potential effect of these pollutants in the health of children, but also understanding the levels of these pollutants, we aim to establish a strategy to clean the air and provide better indoor air quality for the children in Europe. We are developing different technologies. Mainly, probably the most important and interesting is that we are developing 2 types of sensors to evaluate the presence of volatile organic compounds in the air, and also to find the presence of ultrafine particles and to measure the concentration of these particles in the air. This is very important because it can provide in real time the concentration of these pollutants, and therefore we can understand quickly if the people in these settings, in this case children, are exposed to harmful concentrations of some components. Also, we aim to develop an efficient strategy to clean the air of these classrooms, and also we are developing new technologies using organ-on-a-chip methods, using multi-sensing devices, and new biological in vivo approaches to evaluate the potential harmful effects of these pollutants in order to understand if our children are at risk or not. Obviously, children are the most important asset of society, so we need to protect them in order to reach adulthood as healthy as possible. We know that breathing contaminated air is related to delays in development, health effects that appear maybe 20, 30 or 40 years after you get exposed to some kind of pollutants. And it's very important to understand if the conditions our children are nowadays are good, and if not, is the right moment to clean the air and provide the better conditions for the children. It sounds like a cliche, but they are the future of our nations, and of course we need to provide the better conditions to them, and this in time, in 20, 30 years, will mean that the costs for society will be lower, because if we have a healthier society, the cost that we invest in healthcare reduces. So this is highly relevant. The achievements so far is that we are developing prototypes for the sensors. So it's not something that is finished, but we are in the phase of understanding if the settings of the systems we are developing are going to work properly once we use them in the field. We are also in the process of creating new methodologies that allow us to assess toxicity in vitro and in vivo. And those are things that we can count as achievements, because we are already evolving and having results that tell to us we are in the right track. The main challenge is related to recruiting the children, because different nations have different rules and regulations to work with children and to handle samples and information. So that's probably the most difficult part when it comes to do the field work, and which will start happening later this year. So that's the biggest challenge of all, and we are working really hard to overcome any issues. But so far things are looking good. that's very important because we have, from engineers and physicists who understand the behavior of the air and how you can clean the air and how can you measure the presence of a component because you use a laser and you have an excitement of a molecule and you have a system to detect, which is very sophisticated from the point of view of physics and engineer, to things that are much more on the side of the daily life of how the children behave in a classroom, how they may be exposed to certain pollutants, which is this aspect is led to people who is much more on the side of the medical biology, to understand the mechanisms of action of the pollutants, all the way to communicating to society, which is what we are doing now. So we go from basic physics to communication. So the goal of science is to generate new knowledge, but we have to land this knowledge, we have to ground this knowledge in a way that is useful for society, and we have to let know society how useful is what we are doing. Otherwise, if we're failing the communication of the science, people will not understand what we are doing and why we should get funded again. The call that invited us to do this project was devoted to indoor air quality, and they funded 7 different projects that has very different approaches. Some are working with children, some are working at hospitals, some others are working at offices, some others are working at houses. And then what the European Commission did was to gather all these projects in a cluster that is called IDEAL. And we are discussing common grounds we have, common interests we have, and also we are learning from the approaches others are using to have this kind of evaluations. So the synergies are there. We are gathering every few months to discuss and to present the progresses in different fronts of the projects. And we are gathering also once a year to have presential meetings in order to have a deeper discussion about what we do. The idea is to generate information that the society can use to take decisions. So either to improve the quality of air by taking some actions, either we will avoid the use of some kind of carpets because we know that some components now we are finding in the air comes from the carpets, for instance. That's something that could be very useful. All the way to taking much more active actions, like now the schools will require filtration air systems that guarantee that 99% of the pollutants goes away. The 99% is a number that comes out of my head now. I cannot promise that, but this is what we would like to have, a real impact, providing decision takers and associations and so on take actions to benefit the health of children in the case of Learn project, but the entire society in the case of all the projects that are related to us. The overall contribution to society is to provide knowledge to take the better decisions to protect the health of children at school. Of course, this later on could be assessed or translated into the home environment. And there is also many groups working on outdoor environment. So it's a piece of the puzzle, but we think that we have a good chance to provide good information to decision takers in order to have the better actions to improve the conditions for the children. These kind of projects have an overall cost between 6 to 8 million euros. So it's something that without the support of the European Commission cannot be done. So it's essential to keep ourselves working and providing good information to the society. And of course, we have the knowledge, we have the consortium of Learn has 11 partners, but these 11 partners gather more than 60 people. So if you consider that the 4 years of duration will provide a huge amount of information, the cost that we use at the end of the day is not that much, despite 8 million euros may sound like a huge amount of money, which it is. But at the end of the day, it worth the effort because we are going to provide better conditions to society, and we need the European Commission to keep funding this kind of projects.